Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Wednesday, April 22nd, and this is my daily briefing. We've had a total of 41 cases to date in Missoula. 39 of those cases were identified by testing, and 2 were epi-linked. We have 33 cases that have recovered, and we've had 1 death, which leaves us with 9 current cases that are in isolation. The state of Montana has had a total of 439 cases and 12 deaths. Today I'm going to talk about active cases and perceived risk, contact tracing, and the quarantine and isolation site, also called non-congregate shelter. Yesterday you heard that testing expanded a week ago at the Missoula County COVID-19 Testing Center to include any Missoula County residents or healthcare providers or first responders with symptoms. In the first few days of that expansion, we were able to identify 3 cases that we wouldn't have otherwise been able to identify under the previous testing restrictions. These restrictions, as we talked about before, were based on CDC guidance and caused by limited supply chain issues. Why am I bringing this up? A couple of reasons. First, now that we have the supplies that we need people to get tested who are having symptoms. So please call our hotline at 406-258-INFO. That's 406-258-4636. Select option number 2 to speak to a nurse and to get an appointment. You don't need a prescription and the service is completely free, but you do need to have an appointment. If you don't want to come to our testing facility, you can certainly connect with your healthcare provider or another testing and screening center. These other providers are listed on our website at missoula.co/cvirus. The second reason that I'm bringing this up is that we want people to understand that there are more COVID-19 cases in the community than people actually realize. The numbers that we're reporting to you are the cases that we have identified. However, with community spread and the previous limitations on testing, we don't want people to misinterpret the data or their risk of getting COVID-19. The testing center last week had a higher positivity rate than we've seen in the state of Montana. We're likely going to start identifying more cases as we're able to get more people tested. People continue to ask about the active number of cases and try to compare that number to cases in other cities and in other states. While this number is interesting, it's really ripe for misinterpretation. While active cases can be a useful number in some circumstances, the number of active cases for COVID does not actually reflect the amount of disease that we have in our community at this time, nor does it tell us where we are with this pandemic or indicate risk level. We need to recognize that many things have contributed to our lower numbers. We've had a stay-at-home directive in place for several weeks. We've had a lot of closures. People have really done a great job of modifying their behavior to support better health. Overall, we've just been able to limit activity in our community. All of these things together has helped us keep the spread to a minimum. However, we have also had limited testing ability. So with the limited testing ability, that means that we've missed cases in people who did not meet the definition of high risk, which is particularly tricky when you consider that we have community spread happening in our community. So the bottom line is that the number of active cases is based on incomplete data and restrictions like the stay-at-home directive that could change this week. It does not translate to risk or indicate if the outbreak is winding down, so please don't misinterpret the numbers that we post and change your behavior, putting yourself or others at higher risk. Also, please do not compare our active cases in our jurisdiction with another jurisdiction and conclude that we have less disease and so therefore maybe it shouldn't be a concern. We don't want the efforts and sacrifices that we've all made over the last several weeks to fall apart and cause an increase in cases. To help people understand what is happening with the numbers in our community, we are going to start featuring updates from our epidemiology team. Their expertise can help highlight ways that we can use and understand the data that we have so that we can all make better, more informed decisions. So next I'm going to talk about contact tracing. We have had people reach out to us asking if they can help with our contact tracing and case investigation. We understand that other areas of the United States are recruiting, but here in Missoula County we currently have enough nurses for this task and have a long-term plan to expand our nursing capacity if needed. Hopefully if we work together, we can keep the curve down and not outstrip our nursing capacity. Right now we're limiting contact tracing to nursing staff because nurses have the clinical background that is helpful when interviewing people who are sick. It also helps when answering questions about the disease symptoms, underlying medical conditions, and really understanding the technical guidance. There's also some concern with patient-protected information. Nurses know what information can and cannot be shared, and this helps maintain trust with the people that we interact with, as they understand that only medically trained people are answering their questions and accessing their information. Especially in times of an outbreak, trust is really essential, and our response relies a lot on our credibility and people really just feeling comfortable providing us with that information. So again, I want to thank those of you who have reached out. At this time, we have the nursing capacity that's required and the ability to expand if needed. But if anything changes, we will definitely be letting you know. Lastly, I want to talk about our quarantine and isolation site. We just want to say thank you to the mayor and the city council for their assistance with attaining the quarantine and isolation site earlier this week. The acquisition of the Sleepy Inn for this purpose provides the health department with an essential tool for separation of those exposed to COVID-19 or needing isolation who do not have an adequate home setting in order to do so. This facility will also provide us with the ability to provide protective sheltering to those at high risk of complications when needed. So without the ability to properly quarantine and isolate people, we really risk additional community spread in our community. So thank you to the mayor and the city council for being our partners in public health. I also want to say thank you to the Missoula community in general. I know that this has been a really trying time for a lot of people, and we really just appreciate all of the assistance that you have been given to us as far as like following our guidance and making those behavior changes that are necessary in order to keep the community spread lower in our community and protect each other's health. So thank you to everyone out there for everything that you are doing, and I know that it's not easy, and we will get through this together. That's all I have for my daily briefing for today. As always, you can subscribe to me on YouTube. That's under my name, Cindy Farr. That's CindyFarr. Click that notification bell so that you get notified whenever we upload a new video. Please follow us on Facebook. We post lots of information there that could be really useful. That's under the Missoula City County Health Department's Facebook page. You can definitely check out our website. That's missoula.co/cvirus for additional information, and our guidance is posted on there. If you have any questions or you would like to request an appointment for testing, please call 258-INFO. That's 258-4636. For testing, you can press the number 2, and that will get you to a nurse that can get you an appointment. You can also ask lots of other additional questions at that info line. We can help you find resources if you need them. That's definitely a good thing to good resource to have. So call us at that number if you have anything that you want to ask questions about COVID in general or resources. That's it for my daily briefing. So everybody stay healthy, and I will talk to you again tomorrow.